My treatment, self-love recovery treatment program, Codependency Cure, is based upon the need to resolve the core cause of self-love deficit disorder, and that is attachment trauma. That is the trauma that happens to a child from birth all the way up until their late teens, that comes from being raised by a pathologically narcissistic parent and a codependent parent. Like any trauma, when the brain cannot manage the trauma, PTSD, if we look at PTSD, post-traumatic stress disorder, the brain has certain capabilities based upon so many factors of how much trauma it can manage. But when it's too much, if you think of circuit breakers, go off and take everything offline when it senses that the voltage is beyond its capacity. When the trauma is beyond the brain's capacity, it cordons off the experience sometimes, but if not, it cordons off the memories and moves it to a part of the brain that is not connected to where other memories are, which is at, on the outer sides of our brain, our cerebral cortex, the human part of our brain, and stores it more in the center of it in the amygdala. And the amygdala is not connected directly to our memory part of our brain. Although this discussion is not about my trauma treatment, maybe another one in the future, but to resolve, to cure SLDD, we have to understand that there is a part of a person that is frozen in time at the age of the trauma. My treatment approach is called healing the inner trauma child. And that is frozen in time in a part of the brain that we can't remember. But because of evolution, our survival instincts are connected to the amygdala. So if we were traumatized and someone witnessed, a shooting in the post office, so they don't remember it, it's blank. Every time they get close to a post office, they get body sensations, their heart palpitations, panic, anxiety. And anyone who understands PTSD or attachment trauma will attest to that. So I use in my treatment program many techniques that connect to body sensations before I can get my clients to recall the trauma, which I do I call it my HITCH method, Healing the Inner Trauma Child Trauma Resolution Treatment Program. I teach them that body sensations is the child that was abused, that doesn't have any memory talking to you. And they learned that is reminiscent of feeling danger in an environment, a person, a situation of their past that they might not remember. And I don't know if you can connect to that, but the body sensations are important to treatment. True to myself, I want to share something personal with you. I had my 60th birthday yesterday. Any person who's self-love abundant, who was formerly self-love deficient, they successfully completed the program and had this permanent transition. And I worked hard to get there. But it doesn't take away what happened to you and the sadness of what happened to you. So yesterday, I had these body sensations and sadness and ache, and I just started looking at pictures of my family. I found this picture of me at 3 years old, actually 2.5 years old. And I didn't know what was happening, but I'm a Photoshop addict. I love Photoshop and I can get lost in it. And I was compelled to restore this photo. And I just kept looking at that child, this little blonde-haired kid with, and I just couldn't stop looking at him. 'Cause sometimes I use my own methods on myself. I actually do a lot. And I realized there's something going on about me connecting to that kid and recognizing how far I have come. And so that what I did was I posted this because when I share something about myself, whether it's on YouTube, social networking, remember, it always has to be for a reason. And I show a picture of that cute little guy, and I say, on behalf of the little guy and the 60-year-old man he became, I say thank you for the warm and much appreciated birthday wishes. Took a while, but after 60 years, we figured out how to be happy and healthy. that's an example of this program, because once you get through it, not only do you remember those memories that were so hard to accept and they become integrated, but it's almost like you have this relationship with this part of you, which I call the inner trauma child, and you carry that along. My job is to resolve a lifelong disease-like problem, so you cannot resolve it if you don't understand where it came from and why you're stuck. So people learn these ideas in therapy about the trauma. They learn about the inner child. By the time people get to discussions about their child and their history, there's a lot of sadness, there's a lot of grief, and you have to be strong enough to feel the pain. That's one of the primary principles of my stage 7, which is where I do my Hitch Healing the Inner Trauma Child treatment. You have to be psychologically strong enough to remember what you weren't strong enough to remember. So whether you've been in my treatment or you just are connected to these memories, whether they're distinct memories or more global memories, you know where they came from. For example, more self-disclosure. I'm going to have this birthday and no one's going to know about it. And I got really sad, but I was thinking about it. And then I realized these are my abandonment reactions, even as a self-love abundant person who's no longer codependent or self-love deficient. In my vulnerable moments, my low moments, I connect to the little Rossi. I was connecting to the abandonment issues, which were my childhood. My parents didn't really care about me emotionally and were never connected to who I was. And I am able to identify that now and shake it off. And sometimes that's the best you can do. SLDD is an addiction. Think about it. If you know a codependent, or if you were a codependent, what happens when you are in between relationships? There's this feeling of discomfort, anxiety, profound pathological loneliness. It is withdrawals. I have a career, 5 years experience in the substance abuse and addiction field. And I started to understand that SLDD fits all the criteria to diagnose an addiction. There's a family history of it. There's a pattern of sacrifices, financial problems, of tolerance. You need more in order to get the same impact. You need, instead of being alone, the next narcissist is always, for some reason, going to be more harmful. There's this feeling of dependence. As you're dependent on alcohol or heroin, you are dependent on the addiction. Now, let me say, SLDD addiction is not the addiction to narcissists. No, it is not the addiction to narcissists. It is the addiction to a relationship because of the profound core shame. Well, I should say the attachment trauma, which is underneath in the background, dissociated or unconscious. The core shame, the loneliness is so painful. You need something to make it go away. And the only thing that makes it go away is a relationship. According to the human magnet syndrome, the SLD, the codependent, is always going to pick the narcissist. That relationship brings the person to a point of paradoxical, artificial safety where they don't feel alone anymore. They feel they can do something. They can help someone. They can sacrifice. They might complain the whole time, but those unconscious elements, the addiction elements, that horrible pain, the pathological loneliness is the number one withdrawal symptom. Every SLD I know knows this, not some, not 50%, that right after the breakup or before the breakup, when they're thinking about it, that loneliness or the fear of it is so intense and painful. They almost always, if possible, they rebound. If we understand SLDD is an addiction, we actually are addressing the core shame issue. Is I explain to any of my addicts, no matter what the addiction is, that part of recovery is relapse. I don't want people to relapse, but I explain to them what the addiction is. It is bigger than them. They are powerless over it. And that is where I bring in, I don't use a lot of 12-step work, but I do use some. That is where I bring in step one. Step one for almost all addictions has wordings such as you are powerless over your drug, and because of your powerlessness, your addiction, your life has become unmanageable. You're powerless over alcohol, and because of that, your life is unmanageable. When you understand that the psychological and the biological mechanics of any addiction supersede one's will, because, and I explain this to all my clients, whether they're SLDs or alcoholics, and I explain, how the brain works and how addictions work and how it's in the pleasure center and how that part of the brain will trick the thinking part in order to get its drug of choice, so that they understand that this is going to be one of the hardest things to break. And indeed, it always happens, and they suffer. And some of them tell me, how long is this going to last? And I'll say a week to like 2 months, maybe sometimes longer, but usually, 2 or 3 weeks. And then, of course, they're involved in treatment. So the principles that we hear of in the 12-step program, especially the first couple of them, are hugely important and folded into the treatment program that I call Self-Love Recovery Treatment Program. The concept of one day at a time is tied to step one. If the addiction is bigger than yourself, that means you need help and support systems, because you're not going to do it by yourself. And it's just too big. It's too tremendously controlling. So then you break down, especially during the withdrawal stage, you break down every day into one day. If a SLDD addict who's going through incredible pathological loneliness and, of course, shame, and it's so painful, and they just go, oh my God, I'll never get over this. And they're thinking the next year of their lifetime, that's way beyond their capacity to understand, conceptualize, and to kind of process from a positive point of view. So what you do is you break it down into parts that they can accomplish. So you say every morning you wake up and you say, today, I am not going to date. I am not going to call my narcissist. Everything that they do is wrapped around that one day at a time. And then as they progress, it's a week, it's a month. So it is a wonderful concept, technique that is intricately connected to step one in the 12-step program and connected to my stage three. My stage three is overcoming and resolving SLDD addiction. I'm a certified drug and alcohol and addictions counselor. For about 7 years, I was a certified treatment practitioner for sex addiction. So, I lived and breathed addiction. So the best way to prepare someone is to let them know. It's like the Surgeon General warning. I created a Surgeon General warning because it sounded cool and it worked in my program, but I think I've been using parts of it in all of my treatment, that if you don't tell people what's going to happen and they can't prepare for it beforehand, it decreases the probability that they're going to have the psychological resources or the emotional stamina to get through to it. So in that vein, I talked to them about the withdrawals, and we set up proactively in our stage three support systems. Some of them I send, not that I have any direct power, but I'll strongly suggest for them to go to Codependency Anonymous or other 12-step groups that connect to some degree. It's not so much that I want them to work a 12-step program, but I think for them to be around other people who are suffering and have created a community and a network of help is often the best way to prepare someone for the hardest parts of the withdrawals.